Ross Cullen is my name. I'm the Digital Innovation Manager with the Digital Transformation Team. The Digital Transformation Team is a subdivision of the Office of the Chief Information Officer in the HSE. And joining today is my lovely colleague Loretta Grogan, who is going to present on some of the final slides. And then I believe after that, Suzanne then is going to talk after me in relation to her experience with some of the telemedicine solutions that have been deployed over the last few weeks. So I'll flick on to the next slide. I know we're tight for time today. Just a very quick overview of the Digital Transformation Team. We were established in the third quarter in 2019. I myself joined the team in late September 2019, and to say at the least, it's been a roller coaster ever since, but something I've enjoyed. My own experience in the HSE overall, I hate to admit it now at this stage, coming on 19 years in the health service, with many of those in various digital and ICT roles. So as I said, we're a division of the Office of the Chief Information Officer, which is the ICT function and arm of the health service. And every quarter we have a digital solutions review board, which we're now looking to meet more often. And this is a board that meets of clinicians, nursing, clinical engineering, and ICT, who look at particularly the innovative digital technologies, the disruptive technologies that you hear about, where we can review those and bring them through various stages, whether it's looking at a pilot phase, a demonstration phase, or to see how we would go about broadly adopting that across the organization. So we talk about 5 pillars of the digital transformation, and I've just given you a few points there of some of the information related to each of those pillars. So you can see there that we've developed our digital strategy. We have a master's as well. You can see one of the main pillars there is the Digital Academy. So we have a master's that is accredited by the University of Limerick, and there's modules taught by each of the hospital or each of the universities around Ireland. So it's like an all-Ireland masters, which we're very proud of. There are 50 students on the masters, and you can see 44 of those are actually HSE staff. So it's great to have that mix of clinical staff, nursing, health and social care professionals, and ICT staff who are all able to come on this masters and really push the boundaries of what we can do within the organisation. We try and tee up the masters in such a way that their projects are able to benefit the e-health ecosystem of the HSE. So there's a real investment back in the organisation as a result of those. The next one we talk about is the HSE Digital Labs, our innovation portfolio. So before COVID, we had more than 40 digital innovations that we were managing through our various pipelines. For the period of COVID-19, which I'm going to specifically focus on today, we've had to push that portfolio aside and concentrate on solutions that are specifically COVID related. The last thing I'm going to talk about is the Digital Academy Forum. We had 2 last year, and we are planning to have another one via webinar in the next couple of weeks. So I would say to follow our HSE Twitter page at HSE_DA, where you'll be kept up to date on when that is happening. So this is kind of a high level overview of how digital transformation ideas start from a conceptual phase all the way to being adopted. So you can see at the very beginning we talk about this as being a funnel. So you can see over on the left hand side we've got the various ideas. Our team then assess each of the ideas, the proof of concept stage where we look to try and do pilots and see is there something in this where we can scale it up and have it as a more permanent solution, as opposed to pulling it out after 6 months, which is what we don't want to do. So the funnel gets smaller and smaller as the solutions are funneled down, and you can see there on the right hand side, then I have to move my little video screen. We can see that we have 7 solutions already adopted anyways. So we've had great success, particularly it's unfortunate in a situation like COVID, that we've had success and been able to accelerate some of the solutions. Off the top of my head, personally speaking, I would say it would take 2 years for some of these solutions to have got through in normal circumstances. So we've had a real success over the last couple of months, and there's a real feeling out there for innovation, which is fantastic to see. So I'm going to talk about some more of the solutions in detail as I move on. The first, obviously today, I mean, I know a lot of people that are connected today is coming from, an older person services or social care perspective anyways. So I'm going to try and talk specifically about the ones that I think are most, prevalent, or relevant to community nursing units and nursing staff there. So the first that some of you may have heard of is a remote monitoring system that we use for COVID patients. It's provided by an Irish company called Patient Empower. And basically, what it is a pulse oximeter, which many of you are familiar with, a medical grade one, and an app and a companion app. So you put the pulse oximeter, which is down here on the bottom right. You can place that on your finger at regular intervals, and the Bluetooth then will send the results of that over to a phone. The phone then is able to send that into like a central repository where your clinical team that you've been assigned to are able to monitor that, and they're able to get SMS alerts, or emails, depending on what way the notifications are set up, when a patient may be deteriorating. So a lot of patients that we've prioritized with these are CF patients, who might have a low immune system to something like COVID. The WHO have said that the 92% is of blood oxidation is a key indicator of COVID. So hypothetically, what you can do is you can set that as the gauge, so that when a patient's blood oxidation drops below that, that are high risk, and then you can obviously intervene then to bring them in, or to see where you go with their care from there. The next one I talk about is a COVID-19 disinfection robot. Now, this is probably like something out of a sci-fi movie, I have to admit. But many, the traditional ways of, decontaminating a room after a patient, has, a bacterial or virus. So the clinical result, this is another Irish product developed as a kind of a spin-out called Acara. Some of you may know, I think there was trials done in various community nursing units with Stevie the robot. So this is, they've dubbed this robot Violet, which is a kind of an evolution of that, and is specifically designed, to have a UV light connected to it, a low-powered UV light, and is able to go around the room. You can see in the picture here that they have it in a radiology room around a CT or an MRI machine, and so it's able to, obviously maneuver the room by itself, or you can manually control it. And it also has, person detection. So if somebody walks into the room, it is able to turn off the UV light, because obviously, long exposure to UV light isn't good for us. So it's able to detect that. The results are still ongoing. We have a pilot with Tullamore Hospital. The results have been very impressive to date anyways, and we're coordinating with microbiology leads to present the results of them, so that we can see whether we can go to further adoption of a solution like this. So the next one I'm going to talk about is mobile X-ray. So this is a company based in the east of Ireland, predominantly around Dublin, and from a perspective of generally admitting patients or transferring patients by ambulance from community nursing units or nursing homes into a busy acute hospital, there's quite a lot of cost in that. Obviously, the patient's health overall, both physical and mental, having them brought into a hospital, the cost of the ambulance team to come out, the cost of nursing from the community nursing unit. So why can't the X-ray come to you? And this company have done such a thing anyways. They have radiographers who are qualified, and obviously crew registered, and then they have a consultant team to review the X-rays, and a turnaround time of 1 to 4 hours in from when the scan is done then. So the company have provided us a few stats here today. You can see since lockdown, 9 new nursing homes requested, and 35 overall have come on stream to date, both private and some public. 57 X-rays in that time, including 18 chest X-rays, 3 post-ops for just checking to ensure the patient is okay post-op. 6 acute fractures where there was required hospital treatment and 4 minor fractures which were conservatively treated there. But I think the biggest thing to note there is 51 older persons avoided transfer to ED, and considering one of the patients was 101 years old. And I think it's, nursing homes are reluctant to transfer residents into a hospital unless it's absolutely necessary, and that's very much the feeling from family and residents as well. I suppose, from an organizational perspective, there is challenges with implementing such a solution. It's very new, it's very innovative, and it's trying to find a way where, we can get this on a broader scale, and going through, all the various governance and rigors from a health and safety perspective as well. During the COVID, the company took all the precautionary measures, such as PPE, and disinfection of the machines as they come in and out of the van, anyways. So look, something very exciting, and we hope to have further conversations with our radiology leads and nationally, and see how we would go about bringing the X-ray service to the patient, as opposed to bringing them into a busy acute hospital. I'm not going to go through much detail on this one, because I know that some of our speakers, Loretto and Suzanne, are going to talk about their experience with the patient video consultation or telemedicine. But there was two kind of main solutions that were used for patients at the time. Red Zinc is an Irish company, and they have a product called Blue Eye Direct. And I think why I highlight this as opposed to the other one we're going to talk about, Attend Anywhere, is the company really went above and beyond to pull out all the stops to have a solution in place in a very short space of time. So you can see at the bottom there that we had a solution already in use in James's and Tala on the 16th of March, and we had a significant cohort of mental health staff. I think mental health was a kind of an easy one to do, because a lot of the time it's that face-to-face consultation. You don't need to actually be able to look at a patient from a diagnostic perspective, having to look at lesions or lumps or bumps and things like that. So it made it very easy to be able to roll it out through mental health. And as you can see there, on the 20th of March, we had the system up and running. You can see the 2-week activity there recently. At the moment, there's 563 active users using the Red Zinc Blue Eye solution, and over the past fortnight, then there's been over 1,400 video consultations with an average call duration of 23 minutes. And I'm sure there's probably just similar stats, if not more, with the Attend Anywhere solution, which is being prioritized for the time being. The other solutions that you can see there, which we'll talk about in more detail, for bigger groups or webinars like this solution recommended by the HSE and that they've managed to secure a few licenses for, is Cisco WebEx. Microsoft Teams is another one we hear about, and Skype for Business, which is one that we would use a lot in the organization as well. There has been a temporary exemption for using WhatsApp, but it's only a matter of time before that will be stopped again. And I can't stress enough, it's important not to to be discreet, when anyone is using WhatsApp, with patient information and things like that. The next one, anyways, and Loretto, who's going to be talking in the moment, anyways, has been a huge help on this one. This non-contact infrared thermometer kiosks. So it's basically like a tablet with a thermometer scanner on the top, and you simply walk up to it and it's able to take your temperature. The system does have other features. Potentially you could use it as you could put it outside wards or theatres or particular rooms, whereby it will identify you as a person, as a member of staff, whether to let you in a door or not, and to check your reading at the same time. But specifically for what we've done as the pilot that we're working on at the moment, it's literally a non-contact thermometer sensor, so that if you're working on a busy ward, or in an area with a lot of patients, that that you can discreetly walk up to this. It's not connected to any systems or gathering any information, and you can just discreetly check your temperature without having to take one of the Braun temperature monitors and stick it in your ear and have to handle it. And generally what you do then is, obviously if your reading is in the high range, then potentially you can ask one of your colleagues or go for that clinical grade thermometer and do a kind of a double check. So we have rolled out those to a number of nursing homes and hospitals at the moment, and we're awaiting the evaluation of that. Another application that we've used and that we had a lot of support, this was really driven from clinicians from the ground up, and the respiratory team led by Professor Richard Costello were key pivotal to the implementation of the system, and they worked with a company called S3 Connected Health in Dublin. And what they've managed to do is co-design something which, in my opinion, is kind of very similar to, you know, using the method of how the early warning scores is. So they have a COVID-specific, a COVID critical care index. And so the app, so that's the core of what the app does. So this would be a way to monitor patients' OBS on the wards, and use this CCCI the index to actually be able to see where the patients are deteriorating the most, and you can use this, you know, particularly with people that you mightn't have respiratory consultants or experts on the ward. So this would be for those teams, you know, I mean, as a kind of a tool or support to try and avoid escalation to ICU. So it's been running in 6 hospitals, and obviously, you know, with COVID-19 plateauing, anyways, we've left it on standby for the time being. But no, has been a fantastic tool in the monitoring of COVID. This is just something that's that I thought might be of interest as well. One of the innovations that's coming through, which is a sharps device, or a medication adherence device. At the moment, it only does sharps with needles. And we're hoping that, you know, a medication version sorry, we're not hoping, there is a medication version in the pipeline anyways, and there's, you know, other solutions in the market that we're evaluating as well. So what this is able to do is it's able to remind you through the app or through a text message of when you're supposed to take your medication, and you know, if you're taking biologics or taking medication, you know, through a syringe, it has a little post box on the top there which you can see. So it's able to know then that you've actually taken the dosage. And what's impressive about this is that it has machine learning algorithm that's set up with IBM's Watson. So it's able to actually take an image off the needle or off the syringe and see that the dosage has been taken. So it's a real great method of, you know, medication adherence. And it's got a nice dashboard as well to just be able to show, ensure that you've taken the medication correctly. So I'm going to leave it at that. I'm going to hand it over to Loretto at this. So I think this was a good statement that always sticks with me, and it was particularly, you know, we're a small team and in the area of digital transformation, and some of you might know the famous Russian physicist Ilya Prigogine, who once said, in an unstable complex system, small islands of coherence have the potential to change the whole system. Thank you very much, and I'll hand you over to Loretto.
Thanks, Ross, and thanks, colleagues, for having me speak. I think I probably know a lot of you who are on the line already. I'm just very aware of time, so I'll be 5 minutes. And just to say, colleagues, I've worked with a lot of you who are on the line in terms of older person services, and I have seen huge innovation in services and a huge will for digital in older person services in the last year since I've been in post. I'm just going to talk briefly about telehealth from a national perspective. There is a national telehealth infrastructure being implemented at the moment. Was a lot of work done around selecting an appropriate platform, and Attend Anywhere was that platform of choice. So the slide I have up there is just giving you an overview of the governance telehealth. There is a national telecare telemedicine group chaired by Maurice Farnan, and there are also various support groups in acute and CHO services to help with the rollout of that. That's great. So like I said, Attend Anywhere is the platform of choice. So it's an encrypted web-based platform that enables healthcare staff to offer video consultations to patients. It's set up like it has got a virtual waiting room, and it's got a consultation room, and you can have up to 6 patients in the waiting room at any one time. And it's available to every service nationally. So just in terms of older person services, there is a national digital response team from a nursing perspective. So there is a project officer and NMPDU project officer in every region available to all older person services to access to assist with implementation, in addition to the CHO leads. So we would really like to hear from you if this is something that you think could help you in terms of service delivery. And just also to update you, we have a proof of concept, 2 proofs of concept in collaboration with Deirdre Lang, the older persons lead, one in Drogheda services and one in older person services in North Dublin, looking at Attend Anywhere and how that could be used to benefit services. Again, we'll be sharing information in relation to that as the projects move forward. I just wanted to give an update in terms of projects that are currently happening at older person services. One of them is obviously the single assessment tool. We have a new provider for that, a company called Momentum. So they're the replaced Open Sky, but we're also looking that Momentum may have additional functionality to support long-term, long-stay facilities in terms of care planning and other additional functionality. So that's ongoing at the moment. We've also started a digital improvement project in St. Mary's, and we'll be using that as a site to look at digitalising older person services. So that project we're just finishing the business case, and that'll be going into the Digital Government Oversight Unit, hopefully within the next 2 months for sanction. And that is a project that's starting at the bottom. It's everything from digitalising, providing the hardware, look at what solutions could be put in place for service provision in older person services. And they're the main projects that are running at the moment in terms of older person services. We're also working closely with Michael Fitzgerald's office and the office of the CIO in terms of the strategy for older person services and prioritising what the needs of older person services are. And I know our office has been linking a lot with the directors of services in terms of priorities and what we can move forward. Just to say thanks for the opportunity, and our office and the office of the CIO, we really want to work better together in terms of digital. We want to work with Ross and all the other offices in terms of innovation, and to work with services to push the digital agenda forward for services and for patients. Thank you, colleagues.
So thanks for having me, and I'm the physiotherapist in our early supported discharge team in Tala. So for those of you just that wouldn't be familiar with the service, it's a multidisciplinary team service that rehabs patients post-stroke in their home, so facilitating patient flow and early discharge of patients from a hospital who need to continue rehab but don't need to continue that in the hospital. So we visit people in their home and give them the rehab, either physiotherapist, speech therapist, and occupational therapist. And we have had patients go to nursing home as well that we've also visited there. So I suppose when the pandemic hit, we needed to change our practice, and there was a UK and an Ireland collaborative ESD kind of statement to say that it was vital that our services continued and that it was really beneficial to help the patient flow out. So we had to look at towards tele-rehab, really, because they would really wanted us to kind of prioritise or adapt that if we could and have less face-to-face contacts with our patients. So we are using the Attend Anywhere platform and it's been very successful to date for us, and even though a lot of our patient population would be over 65 and there is challenges certainly around providing tele-rehab to those patients, and it's not suitable for everybody, but we have had success, and we've been surprised with some of the older patients who have welcomed it and have kind of embraced it and enjoy having that contact and having that rehab through Attend Anywhere. Now, often we would find just with that platform that for our patients there would need to be facilitation with a carer because to enter the platform, you know, there's putting in a name and a date of birth, and there's a kind of cognitive load for our patients after a stroke, or maybe patients who are aphasic, and they would find that challenging. So we would certainly recommend with our older patients that usually they would have a carer or somebody facilitating that. However, I've had other patients who have managed absolutely fine on their own, and so we have introduced it. We are still doing our face-to-face contacts. It's often a complementary thing with it, but certainly we feel it's been a positive addition to our service. I suppose in relation to nursing homes, we would say we have found in the hospital here patients are coming in deconditioned through inactivity and have become quite weak, maybe post-COVID, or just have been isolated within nursing homes, have entered our hospital. So we would definitely recommend that for patients that have come off baseline, that it's a possibility to have a therapist or a physiotherapist assess patients in nursing home through a virtual platform. And certainly, you know, we can do very successful assessments on patients, and it certainly could be something if physiotherapists aren't able to go into nursing homes or aren't willing to go in, they could certainly use a virtual platform, and you can successfully assess patients through that. But we've also recommended in our day hospital here, we're recommending to older patients that there's a lot of platforms out there to get patients moving and exercising within the nursing home that doesn't require skilled therapists all the time. And there's an excellent service from Seal Blue, which are kind of exercise therapists. It's a not-for-profit organisation, and they provide very good exercise programs. They do, I know they're currently visiting homes, and they do go into nursing homes, and they offer really good one-to-one or sort of class-based exercises. They're on YouTube. It's very accessible, free to use, and I think, you know, if there's a room within a patient's room or in a room to just pop these things on the telly, there's a lot of YouTube videos. There's a later live training, and they offer really good seated to standing exercises that patients could do in a group of 3 or 4 or individually with one of their carers, just to get them moving. It's so important to get these people moving again, and there is a lot of you know, good clips and good exercises on YouTube to facilitate that if it's something that could be used within a nursing home. Certainly in our day hospital here, we have our physio assistant, Jerry, who does an Otago style exercise class, which is strengthening and balance, and that is on YouTube now and for people to access as well. RTE are running a really nice 15-minute exercise slot every day at 2 or 2:20. Something patients could definitely do, chair-based or standing exercise for 15 minutes each day, and it would really help get them mobile again and get them strong again. So I think there's plenty out there that could be on offer, that could be accessed quite easily for people to help facilitate, get people moving and kind of back to their baseline again.